Hello class, this is Heaven. This is going to be my full patient assessment, both medical and trauma. Here to help me is my little brother again. So let's start it. At approximately 0900, I was called to a bicycle accident, and there was a male patient approximately 14 years of age who fell down and did something to his ankle which he didn't know exactly what was going on, so he called 911. So this is our scene. Before I exit the ambulance, I want to take necessary BSI precautions and put on some non-latex vinyl gloves to prevent latex allergies, and also some eye goggles to prevent from blood squirting. Also, I want to ensure that the area outside of the ambulance or my scene is free from any environmental hazards, such as a fire or a chemical oil spill, whatever it may be, and also that it is safe for myself, my partner, and then my patient. And there's only one patient, a male patient, and his mechanism of injury is a bicycle accident. And I want to call ALS at this time since I don't know the extent of his leg injury or whatever injury he may have. And I want to also take out some spinal mobilization devices since he could have injured his spinal cord or his back during the accident. However, there won't be any need for extrication since he's out in the open street. So I exit the vehicle, and as I'm approaching the patient, I want to form a general impression of him. As you can see, he is crouching down, holding it onto his left ankle, which from my perspective is kind of swollen, kind of deformed, and also his left leg has some minor abrasions and bleeding as well. And also at this time, I will check his entire profile to see if there are any life-threatening injuries, such as a major deformity or major bleeding, which I don't see anything at all right now. So I'm going to start my patient report. Hello? Hi, I am Heaven. I'm an EMT from AMR. Could you please tell me your name?
Daniel,
Okay, hi Daniel. How old are you?
14.
Okay, Daniel, could you please tell me what happened to you right now?
I was riding my bike and I was going down a huge hill thinking I could go down it, and I almost hit a car. And I tried not to fall, but I fell, and I think I dislocated my ankle or something.
Okay, so I'll go ahead and take a look at that, but before I do, I need to get your consent to help you, so may I help you?
Yeah.
And also, this may sound a little repetitive and why you're asking, but could you please tell me where you are right now, the date and the time?
I'm in my house. It is January 25th, and yeah,
And approximately the time?
7 o'clock.
Okay, cool. So from that initial patient contact, I was able to learn a couple of things about my patient. First, he is very aware of his person, his surroundings, and where he is right now. So he is A on times 3. Also, he's very alert to his surroundings, so he's A on the APU scale. I also learned where his chief area for complaint was, which is his left ankle. And also, I learned that I also gained his consent to help. So now I will go into the additional BSI. I don't see any need to bring out any additional equipment other than the one that I have on my person right now. So then I will go into his ABCs. Looking at him and hearing his voice clearly, his airway is obviously patent and there's no signs of dyspnea or anything like that. And for his breathing as well, I couldn't hear any stridor or any sounds that may indicate an obstructed airway. So he has a very good breath sound as well. And he is effortless breathing. But I'm going to check his respiratory rate right now. I'm just going to lay my hand on you, just breathe in and out just normally. Okay, from that assessment, I was able to learn that he is a bit tachyphenic with a rest per minute of 24. However, he does have some adequate chest rise, bilateral equal chest rise, so that's good. Now, before I go into anything further in circulation, I want to assess his left leg, which has some minor abrasions and bleeding. To do so, I'm just going to take some clean water, wash off the wound, and put a dry, sterile bandage on him to prevent any infection. Okay, so once that I've done that, I'm going to check his pulse. So could you please give me your hand? I'm just going to check your pulse real quick. Okay, so checking his pulse, I could see that he is tachycardic as well with the rate of 110. However, his pulse is very strong and bounding and is good quality. Also, his skin's upon palpitation is very warm to the touch, very dry, and has good color. Okay, and since Daniel is 14 years of age and not 6 or younger, I will not check his cap refill at this time. Next, I'm going to check his chief area of complaint for any deformity. Now, comparing his ankle, left ankle to his right ankle, I can see that there is some deformity going on with the ankle, but I will go into that later. And exposing his area of chief complaint, which is his left leg. Sorry, I'm just going to do this real quick. I have taken care of all the abrasions and the bleeding going on at this time. So right now I'm going to say that Daniel is pretty stable. However, I do want to get him to the hospital as soon as possible so that he could get his leg checked up by the physician. So I'm going to go lights and sirens and just transport him as soon as possible. So at this time I'm going to go into assessing his body as a whole to see if there are any deformities or disabilities that I missed during my initial patient contact. So Daniel, I'm just gonna go from head to toe. Okay, I'm not gonna touch your left leg obviously because it hurts. But when I go through your body like that, if you feel any pain, just let me know, right? Okay, so his head area is free from deformities and he's not showing any signs of pain. Same thing goes for his upper chest, his abdomen, his pelvic area, and his right back. Oh, okay. So his leg hurts as well. So I'm going to go into that further. Now, before I applied the bandages to him, I was able to see that he had some abrasions on his leg. However, there were no obvious punctures or penetrations. There were some contusions and bruises going around. And also there is some swelling on his left ankle, which I want to kind of look at. Could you just gently, I'm not going to touch it, okay, I'm going to just compare it to your other side. And seeing it, yeah, it is pretty swollen up, and also I could see that it may be a minor or a severe ankle fracture, maybe a displaced closed fracture, which I need to really look at. To treat this on scene pre-hospital setting, I want to apply a splint onto his leg, making sure that I secure the joint above and below his area of injury, and that I pad the splint so that he is comfortable during the ride back. Okay, so I'm just gonna apply the splint. Okay, with the splint applied, I want to help him onto the ambulance and go right away. And on our way back, I want to conduct his sample history and OPQRST. So Daniel, I'm just going to ask you some questions right now. We are on our way to the hospital, so we'll be there in about 10 minutes, okay? But I just have some questions for you. So, this is about the injury. When did this accident approximately occur?
Around 10, 20 minutes ago.
Alright, 20 minutes ago, okay. So it happened 10, 20 minutes before we arrived at the scene? Okay, so is there anything that you could do to the pain to make it go away or anything to make it worse?
I don't think I could walk on it, and if I touch it, it hurts.
Okay, gotcha. How would you describe the pain?
It hurts a lot.
Okay. Now, does this pain, does it stay only at the ankle area, or does it go to any other parts of your body?
Just my left entire leg.
Left entire leg? Okay, so that is expected. Does it come and go, or does it just stay like that?
It's just staying.
It just stays, okay. So from a scale of 1 to 10, 1 being absolutely no pain and 10 being the most excruciating pain you can probably tolerate, how would you rate the pain?
An 8.
An 8, okay, so it's pretty severe. Now, how long did you have the pain for? Ever since like 10 minutes before we arrived and up until now?
Yes.
It's, okay, cool. Signs and symptoms, the patient is showing positive signs for a potential fracture on his ankle. There are no other contusions or any other deformities around his body to indicate anything else. Daniel, do you take any allergies? I mean, do you have any allergies?
No.
How about any medications? Do you take any medications at this point? Over-the-counter drugs? No? Okay. And also, were there any cases in the past where you had to go to the emergency room for a reason?
Yes, once.
Okay, what was that reason? What was it for?
I hurt my head after a gym accident.
Okay, gotcha. And what was the last thing you ate?
I ate food. I had a sandwich.
Okay, and when did you have that?
An hour ago.
An hour ago, okay. And events leading up to this injury, you were just riding your bike down the hill, that was all you were doing, and that's what caused it? Okay, is there anything else that you would like to tell us about this? No? Okay, cool. Now I'm gonna ask you some more questions. How much do you weigh, Daniel?
I weigh around 110.
110 pounds. And do you take any drugs or drink any alcohol? Do you
No.
smoke? Okay, cool. Now at this time, I'm just gonna take your vital signs, okay? So you could just assume that position. I'm just gonna apply a blood pressure cuff on you to take your blood pressure. And the patient's blood pressure right now is about 120/70, which is a very normal blood pressure. Also, I'm just gonna take a respiratory rate right now. Okay, so the patient's respiratory rate has dropped down from the previous 24 beats per minute to now 19. So he is calming down, which is something we would like to see, which we want to see. And also your hand for your heartbeat. Okay, so now that has gone down significantly as well. It is at a 95 beats per minute, which is normal. Also, I would check his cap refill again at this time if he was under 6 years of age. And yeah, and right now I'm going to go into assessing his neurology. Throughout this patient contact, he maintained ANO ×3. He was aware of his surroundings, he was aware of his person. His eyes were pearl, so they're both round and reactive to light. And he maintained an A on the aptitude scale since he was constantly alert of where he was and things like that. Now regarding his GCS, since he was very spontaneous and responsive with his eyes, he receives a 4 on the eye scale. In terms of conversations, he engaged in a very meaningful and very focused conversation with me, answering questions in an appropriate manner. So he receives a 5 on the conversation scale. However, for motor, ever since the beginning, he was localizing his area of pain using his hands around his ankle, as he is doing right now. So he receives a 5 on the motor scale. So in total, that is 13 points on the aptitude scale, or on the Glasgow Coma scale. At this time, as we are nearing our destination, which is the emergency room, I want to continually assess his vitals every 10 minutes since he is stable right now. I want to make sure that his leg is positioned in that of comfort to make sure that his potential closed fracture doesn't become an open one. And when I get to the hospital, I'm going to relay all this information to the emergency staff and just extend our care to them so Daniel could get his leg treated. Thank you for watching my patient assessment, and I hope you guys have a good one.